Here we go. Hello, everybody. Welcome to the Building Recovery Capital podcast. We are glad that you are here. My name is Joanna Dolan. I'm here with my buddies. But before we get started, let us just break down what Recovery Capital is. So this podcast is all about Recovery Capital. And Recovery Capital is the internal and the external resources that we develop in order to obtain, maintain, and sustain long-term recovery. So let me go ahead and let my friends introduce themselves. Amy, you want to go ahead and introduce yourself?
Yes, so my name is Amy DiPietro. I am a person who is in long-term recovery. I am also a patient advocate for a clinic in, multiple states now, Comac Recovery Center, as well as their alumni coordinator. So this is a really awesome experience to be doing this with Joanna, kind of our combined experiences and quote unquote expertise, and getting to hang out with like just some of the most amazing people that have awesome stories and a whole lot of information to share with us, which I love. So yeah, sure. Glad to be here.
Thank you. T, you want to go ahead and introduce yourself?
So good evening, everyone. My name is T. Scott, and I'm a person in long-term recovery from a family perspective and the founder of the Maryland Peer Advisory Council. We also have an advocacy and leadership program. Thank you for having me.
We're so glad that you're here. We were saying right before we started, like we get to interview our heroes, and you are definitely one of our heroes. Especially not just because you're a peer from a family perspective, but what you've done with it. So I think the thing I want to ask first is tell us about Maryland Peer Advisory Council. What is it?
So Maryland Peer Advisory Council is literally a peer-led advocacy organization. We started in Baltimore, Maryland. The Baltimore Recovery Movement was going on well before Maryland Peer Advisory Council. And what we understood is that people needed to organize around recovery. You know, there were plenty of people doing the work. They were volunteers. They had taken trainings, and we just brought that in. So it was just about mobilizing who we are, just saying, hey, we are the recovery community. We're here in Baltimore. And then we also outsourced to other regions within the state and said, hey, let's talk about recovery here. So that's how we originally got started. We actually were called BPAC before Impact, and Baltimore Peer Advisory Council. And then the great Carlos Hardy, who coined Impact, came into one of our meetings one day and said, literally just candidly said, hey, you might want to put Maryland on that. So we became the Maryland Peer Advisory Council. We voted on it, and we all became the Maryland Peer Advisory Council. We were all quite crammed in a small room in Penn North Resource Center in Baltimore. So that's what started Impact. The credentialing had started for the state of Maryland, and we knew that we needed to organize and tell the state who we are and let them know that we are here. So other jurisdictions joined us. We just learned from each other, and then they went back to their respective areas to do the work. We understand that we couldn't do it all. And as we were being grandfathered in for the state, we were traveling. They had us broke out in regions, and we were traveling from region to region to get trained through this time period for certification. And then we just started advocating for issues that really mattered to us for peers across the state of Maryland. So that's who we are. We are a peer-led org. We do everything specific for peers, for their loved ones, their families and allies, to include faith-based members. And we provide training and support and technical assistance toward Maryland State certification.
I gotcha. So how long have you been around?
Oh, I've been on this earth for I'm not gonna tell my age. But it's funny, I was introduced to recovery at a very early age. My mom, who is in recovery now for 15 years, but I was able to see her process very on, and early on, and I understood that families just didn't receive the education and the knowledge that they needed around substance use, addiction, and recovery. So I was when you asked that question, I can tell you I was introduced to recovery in my early teenage years, around 13 for the first time, transporting my mom to treatment and watching her get out the car and then leaving her behind. Um, very early on in my teenage years. And then reintroduced to recovery uh, at, at work. I was actually serving in a jail addictive service unit, and I was kicking and screaming about being in this unit. Like, why they put me in here? You know, because for all I seen from the lens of a person in recovery was pain. And the last thing I
Mm.
wanted to be is surrounded by 64 women in pain,
Uh,
you know. But I was able to have the time to engage and talk and listen to a lot of the concerns and issues that women and people in recovery experience. And it just unlocked the door for me. It just opened me up to this level of understanding. Like it reduced probably 85% of my stigma, about recovery. Because for a family member, you truly don't get it. You're not introduced to it. And I'm very clear when I tell people from a family perspective, in those times, I, the concept was your loved one went away and they were supposed to come back better. They're supposed to come back and be a parent, supposed to come back and do all the duties that are responsibilities of a parent. And that was it. And that's what families believe because they wasn't given the information. So from what I learned behind the walls with those women was just truly amazing. And I learned it in other units too, not just that one, but for to watch that volunteerism, their recovery came from volunteerism. They had people coming in, providing meetings and groups specifically for recovery. And I was able to listen to that like, wow. And although I used to chant the serenity prayer as a kid, like I
Mhm.
really embraced it. You know what I
yeah,
mean?
yeah.
Behind the walls. And to see that transformation for a woman to come in the most compromised position to being introduced to recovery is just like a flower blooming. So that's how I was able to come. And then after that, I did some public service work. I just wanted to know about everything that had to do with recovery. And I was introduced to two people in Baltimore who really thought that I would be good in taking a training. And that's funny. I would be good, right? In taking the training. But
So
they
why do you
wanted
say
me
it that way?
I said it that way because that's how it was once posed to me, like, oh, you may be good at that. And I was like, good at what? So when you I'm like, what do you
Challenge
mean?
dropped.
So
Yeah.
wait, so hold on. I love a challenge, right? So I was like, oh, what do you mean good at it? So I was like, okay, I'll check it out. But I realized it was a process, right? You had to apply, you had to be interviewed. And I was like, whoa, this is real stuff, you know? And it
Mhm.
was the Baltimore Recovery Corp. And the Baltimore Recovery Corp was an organization that provided, it was brought in by Stephanie Rollins Blake in the Step Up program. And they were training people with lived experience of recovery in peer recovery advocacy trainings at that time. It was peer recovery advocates first before they became coaches through CCAR. And it was a 5-day training. It was at a college, and I sat through that training. And the first thing was just understanding. People wanted to know, why was I in the class? So I spent 5 hard days explaining to them why it was okay for me to be in this class. Like, I don't need to ask permission. I understand why I'm here. I'm a person in recovery too. I understand from the other side meaning the family side, but we can be bridged if we just learn and grow together. So that was my 5 days of just getting through that. And I successfully completed. And I applied twice to get into that program.
Oh,
I always tell
wow.
people twice. Yep. So, and that's what really brought me into peer coaching and that bridge of certification happened in the grandfathering period, and I'm part of that. And that was vigorous for people with lived experience and without technology and without access to be able to run all over the state, to take these trainings that which were domain trainings towards cert, and then we became certified. So to my knowledge, I am the first family peer recovery certified peer recovery specialist from a family perspective,
That's
grandfather to
awesome.
a state.
What time
So,
frame is that? What time frame are we talking about? Like,
so this was in 2014 when that happened. Are you talking about the time frame of certification, like to get it
yeah,
all done? Um, so peer coaching, that's a 5-day course. And then you have to get all the domains. The grandfathering period took place, so you didn't have to test. That's the thing about the grandfathering period. You didn't have to test. So all in all, it probably took probably over a year or so to get everything you needed, because you still need the same exact things today in order to become certified. The only difference is for us who grandfathered, we didn't sit for the actual test. So we submitted everything, you paid the fee, and you became certified. So that's about certification. Yeah, but it's plenty others who are in need of support and to get certified. And that's how the advocacy and leadership program was really crafted, because I understood all the barriers. So I wanted to remove all of them. So I had an opportunity to receive a grant and applied and received a grant. And monies from that grant are contributed all to peer related services. So they receive all their recovery support trainings. We bring in fantastic trainers who are facilitators for trainings across the state, such as Joanna. And we provide the
Thank you
peer
very much.
recovery coaching trainings to individuals who are interested in becoming coaches or specialists, and they work in all aspects of recovery across the state of Maryland. They receive the technical assistance, the application support, the supervision. We navigate for hours towards certification. So we just try to move all those barriers that was put up before us through that grant.
That's phenomenal. So I have a question, because I think this is like this is it blows my mind every single time that I interact with peers from your cohort. They get to go to Maryland State House and do an advocacy day.
Right. So some of the in some of the members through Impact, or some of our alumni from our fellowship, we actually took a bus down to Annapolis and to advocate and like do a mock training around a bill, and not for or against the bill, just to give them that experience of walking the hallways of Annapolis, which is, unfortunately, we can't do that this year because of COVID. Everything's virtual, but it, it was just amazing what happened. So we put it out there, like anyone can just either get on the bus or show up. And people from every region just showed up from across the state, every region. It was just awesome. It was the first time, to my knowledge, that peers across the state unified on the floors of Annapolis. So it's great.
I didn't know that. That's so cool.
Yeah.
Can I throw a question in? I'm
Sure.
curious to know, what do you, what kind of importance do you place for the peer support community as it pertains to people trying to get into recovery, staying in recovery, kind of, what importance do you place on that?
I don't put any. You talking about getting into recovery and staying in recovery for
Just
the
in
peer
terms of
specialist?
like the role that the peer community plays in terms of in terms of support, peer support.
So just so I'm clear on the question, are you talking about for the peer themselves to maintain and sustain their recovery,
No,
or okay?
for the folks they're trying to help.
So I believe that we need to meet people where they are and whatever that looks like for them. So I don't level it by importance, I level it by need. So if we meet you where you are today and this is all you need today, okay, I think it's about the engagement and the repetition and how we meet and engage people over and over and over again. And sometimes as a peer recovery coach, specialist, advocate, a navigator, whatever, you may be their only person, so it's nice to be able to see a person from who has lived experience, who can engage and meet a person where they are and navigate them toward recovery. I think that's it, just kind of like eliminating all those expectations and just constantly doing engagements. I think engagement is the key to recovery.
That makes perfect sense. I mean, like, people have been saying for over 80 years that connection is key.
Yeah,
One person talking to another is how this thing gets started.
absolutely. Absolutely. I shared earlier about an experience I had when I was volunteering at an agency, and I was part of engagement, and part of my duties were re-engagement, right? And just engaging people, and I was like, that's it? All you got to do is talk to people? Like, okay, all right. But I was learning, I was new, and I was volunteering, and what I didn't understand was parents were being reunified with their children, and they were absent from a program, and the goal was to re-engage them and give them the encouragement to come back, to the program, figure out what the barriers were and get them back. And the first person that I engaged, she was actively using when I knocked on the door. And I'm street, the knowledge that I know outside of personal my personal education, outside of that, I know about the street, so to meet people where they are, sometimes even using their language and understanding culture, I just said, hey, when you're done with that, just come holler at me, you know and she was like, what? And I was like, yeah, when you're done, and safely, I sat outside, I watched my surroundings, and when she was done, she opened the door and we had a conversation, and she was blown by that, that I didn't judge, I didn't say anything, I didn't even talk about it. All I talked about was why I was there, and what did she need. And I think that was a change agent, and that's what we have to do more and more of, reducing the stigma from people, seeing people for what they are, even in their element, and be able to provide whatever you can, while you can, and then come back when you need to, as many times as you can.
So let me ask you this, because I think that's a really important distinction, right? So when you say we need to see people as they are, what does that mean to you?
Mhm. So guess what? Whatever that looks like for me, my lens is not colored by what I see. So I walk up to a person, if they're unclothed, if their hygiene is not met, that's not for me to say, hey, you need a shower. It's like, hey, hi, I introduce myself, I tell them who I am, and that's it. It's not about judging. And if we can remove and eliminate judgment from the recovery process, man, we can go a long way. But the moment that we put our personal biases up front, like, I'm not getting out, it's filthy out there. But is it safe? Because what maybe looks filthy to you may be a palace to someone else. And I had to learn early on to remove that judgment and stigma and shame from people. And once I did that, I can stand right beside a person, man, it could be bees flowing around them. I still would be like, you better watch the bees, don't get stung. I'm all on
Yes.
that, not, opposed to, hey, you smell, let's get you a shower. Because one of the things about coaching that I now understand in peer support, there's a difference in between coaching and telling the person what to do. Coach them into a process, support them, and let them lead you into the process they want for them, not the process you want to see.
Love that. Yeah. Like, this is really about taking people from where they are to where they want to go, and like,
Mhm.
they're really valuable people. They
Mhm.
know.
I mean, without people, we don't have community, right? And that's one of my big things. Like, I love community. I love to travel from community to community and see people and engage them and learn from the differences. Like, I embrace the differences. I want to learn more about it. Tell me about that. They talk about, and one of our faculty members and one of our trainers talks about supporting people in their nothingness and also cultural attunement. We're never going to be competent, but we can be attuned. And I think that's totally different than trying to worry about cultural competency. If I spend my days trying to be concerned about competency, man, I'll never get anywhere. But if I
Yeah.
learn how to ask questions and build my knowledge and my tool set, then we can do some great things.
Oh my God, I love that.
Yeah.
I love that. So that's a little bit different than cultural humility, cultural attunement.
Mm-hmm. Yep. Humility for me is like, okay, I'm okay with this. But attunement means I want to act. I want to learn. I want to know what that means. I need you to tell me that. And I put the power back into the people, and not trying to figure it out. Like, tell me a little bit more about that. I
Mhm.
learned that because in some cultures, you can't even look people in the eyes, so, and when I understood that, I'm like, okay, you're not ignoring me. You can't look me in the eyes. It's cool. Thank you for sharing that, and I understood it. I didn't feel less than, and the person felt respected for their culture. So I appreciated that.
God, that's powerful. Okay, so, oh my God, that's really powerful.
Mhm.
Yeah, that's like really powerful. I gotta take that
When
in.
you, yeah, right. So when you think about this, so you have gone from a child of addiction, right? Like it, like you grew up exposed to it in your immediate family.
Mhm.
And I'm sure you have friends and other family members besides your immediate family. So in some form or another, addiction and recovery has been woven throughout your journey.
Yeah. And I think it's important that we pay attention to our journeys and not kick and scream against it, because I was introduced early on, and I want to say that in the most gentle way that I can say it, my childhood was beautiful. I had great two loving parents. I had a wonderful family, an extended family outside of my home. My community embraced everyone. We really appreciated who we were, and where we lived and everything about it. But I think that there was a culture shift, and sometimes, we can blame it on a lot of things, oh, because this happened or that happened. But certain substances were introduced, and it went from being a party thing to more so in habit, and a habit that became misuse, and a misuse that became addiction, so it's like climbing a ladder to it, right? And you figure out, where do I get off, and for the community and for my family, they didn't get off, so how do we bridge that, so that's why I say that my lived experience is definitely extensive. I do have a family history of substance use, and I will tell people, like, you can live a life, and that's why I enjoy talking to families who are in active addiction, and struggling through the process of recovery, because it's beautiful things that happen in it. There's still unity, there's still fellowship, there's still parenting, there's still spirituality. All of that still takes place in active addiction. It's just they're suffering from a substance use disorder while enjoying all those things. So if we can support the substance use disorder, address the trauma, support them toward individuals who can support them through their trauma, and just kind of navigate them to safe things to do, then you can be introduced to recovery, and families can be restored. And from that, communities can be restored. And that's the beauty about peer support, because the same people who were in those communities and doing some of the things are now educated. They're supported. Their substance use disorder is being helped, right? They're receiving services, or they're in the process of long-term recovery, and now they're giving back to their communities. Man, that right there, it's a force, you
Yeah.
know. is a force, and we're being pushed, we're being introduced into the workforce, and the peers who are doing that work, we kind of intercepted the system. You had case managers, you had clinical services, and you had treatment facilities and recovery supportive housing. And I was able to see those things, but now there's a workforce embedded inside of it. There's peer professionals, there's credentialing, and we had to educate the educators. We had to say, hey, we're people with lived experience in recovery. We can come in and help some of those systems. No, we're not your phone. We're not your trash carriers or your analysis testers. We're really here to support you, to support the person that you're serving. And that was a hard bridge for some. I appreciate clinical services. I appreciate all that, but we are continuing to break down barriers in those areas.
I think that's an interesting thing to say, right? Is because from my perspective, we used to be, like people with lived experience, people with lived recovery experience used to be the clinicians, like we used to be, it used to be nothing but peer support, and then we, got clinicians and I'm not putting them down. Like I've worked with some
Yeah.
tremendous clinicians, I've worked with some people that, like they are passionate and they've got all the book learning and there's something missing. So, like how did you and they want to help people. So how
Yeah.
did you go from building that bridge back into those systems? Did that make my question clear?
Well, I'll do my best to answer it. So I think it's advocacy, using my lived experience, telling them about the things that I experienced, and not making it sad and nasty, talking about the beautiful things of it and what happened from it. Like recovery is possible. I know because I lived it. I watched, I've been to meetings. I watched people go to treatment. I even watched people die. But recovery is possible, if we're giving those resources, if a person is given the necessary tools to navigate them, and access to that too, because you can give a person the world, but if you don't have access to the supports that you need, and for Maryland, that's a little bit different because depending on where you are, the services are provided. And for me, that's a challenge. We should have universal services across the board for the state of Maryland,
So
but we don't.
explain that, because I don't think everybody that's listening knows that.
Okay. So you can travel to different regions within the state of Maryland. If you I think about regions, and I've built my organization on regions based on what I learned from traveling across different regions in Maryland. So if you talk about those regions, you can go in specific regions, state of Maryland, and the same resources that are being provided right here are not available there, or is a lack of, or a stigma around it. But we're all providing the same work. We're all doing the same stuff. But a person who is seeking it will literally drive across the bridge from Eastern Shore to Baltimore because the opportunity is there. So if a person has to do that, everybody can't do that. So, and why? And we need to evaluate that. We really need to think and act locally, do better, to provide and advocate for the supports that we need. So Maryland will be a universal state for all access to services and recovery. That's just my opinion.
What are the barriers, right? What is the barrier? Like, I mean, I'm assuming about legislation.
Some of the barriers, peer support is rising. That's factual. But some of the barriers are access. So if you are a family member, if you are a couple and you want to go into services, right? You want treatment. In some areas, you have to separate. You have to separate for treatment. They don't have syringe access programs for some jurisdictions, or it's being hidden behind a door or in a van. So it's a lot of barriers to services right now, and especially pertaining to young people. We don't have access to treatment beds for young people in seeking recovery. We have a lack of youth and family services, mother and baby, father and baby, or couples. we have to think collectively on how we can introduce those services. There's just such a divide. And in the housing programs, you know, there are regulations around housing programs. If you are a Maryland Recovery resident and you have a program that has a 3.1 level of care treatment, you are supposed to have a peer recovery specialist 24 hours a day. Okay. But you don't provide any funding for that peer specialist 24 hours a day. That's a barrier
That's
for
a
the
big
provider.
barrier.
Big barrier for the provider. So you have programs who are stretching themselves right now to house individuals, to keep them safe, to not discharge them for their inability to pay. They don't receive the funding and the reimbursement for clinical services. So therefore the treatment falls off, and people who are being served, they'll leave for the next place thinking that they can start their process all over again. And you just kind of get them to step back on their recovery. When they were 3 steps forward, they taking 2 steps back. And it's just sad. People should be offered the opportunity for recovery supportive housing if they leave treatment. There should be aftercare. There should be access to community services 24 hours a day, in my belief. Treatment is not on a time clock. It's not. It's not. And if we had recovery and wellness centers who were able to offer that access, that safe haven for engagement until the doors of treatment opens, that would be great. I was sitting in a work group and I asked, hey, could we ask MTA, which is our Maryland Transit, could people who were interested in getting entering treatment or recovery receive a card, just like a card, or say some type of word to get on the bus to travel to treatment, and everybody eyes pop wide open. I'm like, yeah, because transportation is a barrier. If I have,
Huge.
if I sit on a corner and I rustle up $1 and some change to get on the bus, and I get on the bus and go to treatment, and they say, oh, no beds today, what am I going to do? So
Yeah.
it was a hard ask, but hey, you can go over to the Recovery and Wellness Center. You can be offered some support. You can sit in a couple groups. Maybe you can sit in a chair. Maybe you can catch a meeting. You can watch TV, be engaged by a specialist, and talk about, if you're interested, going into services or receiving harm reduction services. I think that would just be, we would save lives that way.
Yeah.
I think we will.
That's
I think you're right.
Just thinking about that.
Yeah. I mean,
because really at the minimum, what you're talking about is just creating a safe space.
That's what I'm asking for.
But there's so many people that don't have that.
This is not new stuff. In Baltimore, we used to have what's called the thresholds, and they were recovery and wellness centers in Baltimore. And some of them were before my time, but I remember one, and it's operating in at minimum capacity right now, of course, because of COVID. But at one point, man, they were open 12 hours a day. They was open 24 hours a day, and I remember that. Like, you going where for a meeting tonight, right now? You're like, yeah, if that's what's going to keep me into the morning, I can be engaged. I can receive some harm reduction supplies. I can talk to a peer. Then I can get a cup of coffee, a snack. That's going to keep me from going out again. And I was like, okay, like, all right, see you in the morning. Yeah.
It's true though, right? Because I think for a lot of us, especially just trying to figure out whether or not recovery is something that you even want to consider, wherever you're at, wasn't safe, right? Even your own home, should you have one, wasn't safe.
Yeah.
So
it's just so many things going on in the world, and the hospital, and I appreciate the OSAP peers, people working like the overdose response programs and in the emergency rooms. I appreciate that, that they're there to provide support, but then you have to be hit with either a medical emergency or have experienced an overdose in order to be engaged, or you're walking into the hospital, you're kind of flooding the hospital system just to get services, and that should not be our gateway. That should not be the only gateway, because there's stigma around being entered into hospital rooms repeatedly um, for substance use disorder. And we should create, say, portals or stations for people to be engaged. And definitely, if they want harm reduction services, and there's a big push right now for overdose prevention sites, and it's in legislation right now. They have an upcoming session, and they've been trying for the last 6 years, advocacy for 6 years, to get an OPS site up. And I'll tell you, no one has ever died in an OPS site. In all 150 of them, no one has never died by an opiate prevention site.
Is it
So
NIMBY that's preventing it?
Say it again.
Is it NIMBY that's preventing them from saying yes?
Yeah. So I don't know if it's NIM. It may be a combination, because you have to figure out how it's going to be ran and who is going to buy. So I think it has to do with NIMBY. I think it has to do with policy. I think it has to do with introduction and how we're going to safely support individuals who are actively using substances. But I think that even if they were here, people would still be alive. People will be alive, and we're losing too many people too fast right now, definitely with social isolation from COVID and no access or limited access due to the COVID crisis.
Yeah.
That makes
Definitely.
perfect sense.
So
So
150. I'm
Go ahead.
sorry. Go ahead.
I think I was
Can I
gonna.
pick? Can I pick? Can I pick?
Yeah.
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 Just kidding.
Pick.
Yeah, go
Mine
ahead.
is really quick. The
Yeah, go ahead.
150 places that you're talking about, like, where are they?
They're all over the world. So they're
Yeah.
all over the country, but they're operating successfully and people are not dying, So if we were able to have one, it's definitely going to be some strategy around it. You want to have to figure out, is it in the health department? Is it going to be community based? Is it going to be in certain neighborhoods? What is that going to look like? So I know it has a lot of logistics around it, but I believe that even if it's just approved for people to apply, approve it, and then let us hash all that stuff out. Staff it with people, staff it with harm reductionists, staff it with peer support specialists, staff it with nurses and wound care, and we're doing some of those things. We came a long way, with harm reduction, but I believe that, is part of recovery, and especially when I'm engaging these young people and some of the efforts that we're doing, you can't talk to them right away. Some people you cannot engage about total abstinence. They're like, I'm not. I'm just not. I'm not. You want to talk to me about something else? Come back, talk to me about something else. But I'm not. So I just talk about reducing harm. Smoke
I
less
get
than you
that.
smoke today.
I get that.
Drink less than you drink yesterday. It's a way. It's a step.
Yep.
And then just giving them those affirmations, and then softly introduce them when they're ready. Then create a space, but we need to have that space created, So I appreciate those who are stepping out on faith and creating programs for younger people, because there's a lot of stigma around that for young people and in seeking recovery.
Oh my God, yeah. So before we move too far past, right? Because we definitely want to talk about young people. Like, I got sober when I was 20, so I want to hear about young people.
Yeah.
Also, I know that it's very important to you, and the work that you're doing is incredible. So my question is, how can somebody who doesn't have any idea what one of these opioid safe injection sites, response places, like, they don't have any idea and they're just like, wait a second, where can they find some information out about it?
Yeah, so there's a harm reduction coalition going on right now. I would suggest reaching out to Baltimore Harm Reduction Coalition or the Bridges Coalition. They can
Okay.
connect you with a lot of background information and resources. They have a lot of knowledge around safe stations and where they are and the locations. Definitely reach out to them. It's good to be educated on new things, especially things that we are not comfortable with. And that's just my thing, just to learn, because, I understand that every person that I meet or engage is not interested in total abstinence right away. They're just not. And sometimes they may never be, and that was a hard pill even for me to swallow when I first came into it, because that's all I knew. Like, you go, you get better, you leave, you go in somewhere and you come back and you don't use anything, But, some people need to be supported, and medicated assistant recovery is what I call it, is beneficial to those who need it, without stigma and without shame.
Yeah, absolutely. So Mara is also something that can help people who are using medication assisted recovery and would like additional maybe 12 step or something like that, right?
Mm-hmm. Yeah.
Okay.
It's so many, as far as groups, you got Smart Recovery, you got All Recovery Meetings. It's so many groups that you can be a part of, or meetings you can be a part of today, especially in this virtual space.
Oh, yeah. Refuge seems to be taking a little bit more traction on the East Coast now, which is kind of cool to see.
Nice.
Yeah, I love that. I think that's pretty
Yeah.
cool.
Yeah,
There
absolutely.
are also some Spanish speaking recovery meetings through an organization called Choices in Lara, Lara. That's like just doing phenomenal work.
Oh, thank you for that.
Yeah.
You're welcome.
Oh, random thought. Did you guys know that Tree of Hope has a Spanish speaking podcast out now?
Yeah,
No,
is
no.
that through Choices? They were introduced to Choices.
Is that who
Choices
they
does great. Yeah, Choices started doing some of the training, but they do great. I mean, just check them out, man. They're rocking it out.
I love seeing the expansion too of different languages, but also I've just been recently kind of a bit educated on this is for the boomer population who, maybe they've lost one of the two have, if it's a couple, right? One of them has kind of gone on to glory, so to speak. And, they're in like, long-term care, like, senior living, but not like everyday need of care. What is it called?
assisted?
So are you talking about like aging, like the aging
Yes,
population?
like
So
there's,
there's a new training for that as well
yeah,
through the Department of Aging. Yeah,
it's
for
on
the
the
aging.
it's on the right. People are living longer, and
Right.
with the absence of partnership, maybe they've lost their spouse or other family members have gone on. I mean, they are seeing a rise in addiction in the aging population as a result of that. So that was interesting. And
Sure.
so making sure that we are offering resources to, everybody, and that really
Yeah.
it's huge.
Just because a person is inside of a nursing or a skilled facility doesn't mean that they don't have a substance use disorder.
Correct.
So sometimes, we are like, we need to brighten our horizons and kind of engage in non-traditional spaces, and nursing homes or skilled facilities, even group homes, are not exempt for outreach.
Yeah, no, and it's funny because when I hear about it, I'm like, oh, that makes total sense. But it's
Mhm.
such a huge, like, just being able to educate people on all of this subject matter, because
Yeah.
you don't know, right?
Mhm. You don't know what you don't know.
There's so much, man. Oh,
Yeah.
so let's bring it back. Let's bring it to one of your passion projects, the
Hmm.
young people in recovery. Can you tell
Yeah.
us about that?
Yeah, I love
Sure.
this.
So in May of last year, during COVID, I lost my daughter. She was 28, and she had a substance use disorder, but she also had a physical health condition, which she was prescribed opiates at a very early age, even before the opiate crisis. And, losing her and listening to her, and she was a peer recovery coach as well. She was trained as a coach. She was advocate for harm reduction based on her lived experience. And listening to her, and I learned and I understood that young people really wasn't getting the voice that they needed, in certain spaces. They didn't have access to services. They didn't feel comfortable in meetings. 12-step wasn't the way for a lot of young people. And she talked about it. And at one time, she used to shampoo hair. So I just thought about it deeply, and it made me think about doing outreach in non-traditional places. And the one thing was to introduce a chapter in Baltimore, and I wrote to young people in recovery. I wrote to young people in recovery. I know I looked at the map and I said, hey, there's none in Maryland. and hey, we're here in Baltimore, Maryland. Let's see if we can get it started, and young people in recovery gives young people and it's really any age, but it gives them the tools and the life skills for individuals to reach their full potential. And I love that mission, right? Just kind of giving people tools and access to resources and advocacy, which that's definitely my lane, for resources that they need to reach their full potential. So after reading that mission, joining Young People in Recovery, we are a volunteer chapter in Baltimore. So one of the advocacy campaigns that we decided to do was called Operation Prevention Baltimore. Operation Prevention Baltimore provides Narcan, a Hope text line number, the Maryland Hope text line number, the Deterra, the safe disposal for prescription medications to dispose of and deactivate opiates, along with community resources in a bag. And we walk the streets and we literally engage people in non-traditional places. And the first place I wanted to engage is in hair salons and barbershops, because I understood that people are in non-traditional spaces. So it's a group that goes out, they provide Narcan trainings to individuals. We literally walk up to people and like, hey, have you been trained on Narcan? No. Most of the time it's no. Um, do you know about the Good Samaritan law? What is that? It's okay to call. It's okay to call 911. It's okay to stay with someone, and people who are with loved ones or family members who experience an overdose, they become scared and they leave them, and especially with young people. So we're engaging people one-on-one. Either you are requested in a group or it's one-on-one, and we give you that Narcan training right there, right on the street. You get the kit, you get resources and information, and we also have a group of us. So you have a community health worker that walks with us. She's a peer. She's a young person too, so to
That's
see a young
awesome.
person talk to a young person is pretty cool. And then we have people who walk with us that are all from lived experience, and they just provide resources and information to people within the community. So that's been going pretty good. I'm enjoying it.
That's
Do you
awesome.
think, do you think there's any potential to try and get into like the high school level education system?
Uh,
I
so
mean,
one of my pet projects is to start a recovery high school here in Baltimore City. There's one in Frederick that we really enjoy, and it's Phoenix. And man, Phoenix is a phenomenal program. We're going to found Lotus, which is Lotus Preparatory Academy, and it's for
Nice.
the recovery high school, and we want it open to multiple pathways. We have a projected date to open in 2023. We hope to acquire a building. That is one of our largest barriers, and if we cannot provide a building, then we're going to go virtual with virtual learning. That's the goal. So that's a long-term path. I understand if we can intercept people very early in age, we can make a difference in their lives. Actually, someone from our advocacy and leadership program just did a presentation on the benefits of having peers in high schools, but I would like to have a full-fledged high school specifically for individuals and not in a non-stigmatizing way, introducing trauma, harm reduction, and recovery in high schools.
That's awesome. So how could somebody find, like, where are you with the Lotus High School?
So Lotus is in its preparatory stages. Like we're just getting started. We did see a building. It's an old school. It has been closed it was closed due to low pupil population. So we were like waiting for it to be given back from the city. It's a process. So the city gives it back. The school gives it back to the city, and then they go through a vetting process, and then the building becomes available. But of course, we have to fundraise, we have to get out there, we have to do some things. So reaching out to Phoenix is what we did for navigation and support.
makes sense.
So how could, like, I mean, maybe someone that's listening to this or that will listen to this is going to be like, hey, I'd really like to support that high school. How can they get
Hey,
in
get
touch with you?
involved. Contact us you can email tscott@mpacmd.org if you would like to get involved. Tell us what you want to do. tell us your vision. We can tell you ours. We just want to see young people reach and be able to thrive in recovery within a school. And that's important because school is a break for individuals if they don't have that support system around them. And can you imagine walking the halls with someone who understands recovery?
No.
Can you
No,
understand?
not
Like,
even
okay,
close.
not get out of my school, not that you're suspended, being supported, and yeah, you know, that's truly, truly important. I can't say it enough.
Oh my God, yeah.
Yeah, I know, I agree. I know Joanna agrees. I mean, we talk about it all the time. Like, the connectivity is recovery.
Yeah,
You know,
yeah.
It's-
And with Lotus, what the hope is that, the student interviews, not the referral, the student. The student says, I want to come in. Referrals are great, but we would like for the referral to come from the student to say, hey, I want to come in, to
So
be
explain
interviewed.
that, because I don't think everybody that is listening or will be listening or watching like understands that difference.
Right. So if you're a student, no matter, you don't have to come from an alternative high school, you don't have to be kicked out, but you learn about the school, right? And you want to come in. You'll be peer supported to complete your application. You'll be peer supported to do your interview. And how great is that? Not someone being voluntold you have to by court order or because your probation officer told you so. We can get referrals from parole and probation, but we really want to talk to the student with permission. And with that, it's going to have to be a consent, of course.
Yeah, that's what I was wondering about. Like a lot of places, like they'll refer people and then like that creates a whole different dynamic, right?
Yeah. So thank you for the referral. We appreciate it, but can you have the students sign a consent so we can speak to them?
well, then it stops being about punitive actions and behavior, right?
Right.
The concept is that you would be like lifted up and supported
Yeah.
by people that understand what you're feeling, have walked where you're walking.
Mhm.
I mean, God, I can't even wrap my mind around that. Like,
Yeah.
I mean,
It's kind of like reversing all these processes that put our children in jeopardy for their education. My daughter was in high school and she attended a high school. And for one, the staff just wasn't educated about her illness. She wasn't educated fully about her opiate dependence. And with that, she missed a lot of days of school, and potentially dropped out because it just wasn't working. I'm tired of being stigmatized. I'm not feeling well. What does that mean? And for them is, because you can't have this expectation that every school system is going to understand every student. You just don't. So she was like a pea in the pod, walking through the halls, trying to get fit in, missing class, partly for her illness, partly not feeling well, partly from being misunderstood, and then becoming angry. And then I don't want to do it anymore. So we don't want kids to quit, right? We want you to be able to come where you're safely supported and get your education. And if you need services, hey, we want to embed the clinical services and in the therapy services right in the school. We don't want 100 people running all over the place and you have to miss school. So create a schedule that's inclusive and create a schedule that includes that wellness time, whatever that looks like, whether you're going to see your therapist, whether you're going to do meditation, whether you want to do something that's conducive for you. But if we build it in, we reduce the stigma, we eliminate it. It's like you eradicate stigma right then and there.
Yeah, kind of. I mean, that's so backwards from how the system is set up.
Yeah. You don't get the note sent home that, hey, your child has a challenge. And I used to tell people on the phone when my daughter was young, hey, I'm only off on Tuesdays and Wednesdays. Don't ask for a meeting until then.
And they're not qualified, right? Like teachers aren't qualified for that. I mean, they don't know.
And they used to call me for parent conference, like, look, hey, I'm only available on Tuesday and Thursday. Like on Tuesday and Wednesday. I only got 2 days a week. Like pick one and then I'll come, So for you to tell me what my child needs.
Well,
Yeah. But if we can, thinking back on it, there's so many times that we can just intercept the system, right? And build stronger organizations that are empowered by people and supported by people who understand.
Absolutely. So let me ask you this. What about kids who are like addicted to alcohol or maybe
Oh,
meth
that's a drug.
or party drugs?
That's a drug. That's a drug. It's not opiate high school. So, it's we understand.
I just wanted to put that
Yeah,
out there because someone's gonna be like,
it's
"Hey,
important
I
that you
don't use
said
opiates."
alcohol. That's a real thing. It's important that you said meth. That's a real thing. It's so many substances out there. We're actually going to probably learn from the students. Like, hey, what's the new thing popping? And we want to make sure we speak their language, we understand, that cultural attunement again, being aware, knowing like what's popping, what was good last week may not be good this week. So we really want to make sure that people are able to support the students the best way possible. And I believe if we have peers in the schools, if we have people who understand recovery as educators or as supportive staff, then we can make some differences in the lives of young people.
Yeah, for sure.
That's super exciting.
But it takes a lot. It takes a lot of work. What I understand and what I'm learning is that you'll have a great vision of bringing things to, but it takes a lot of energy and a lot of work to get it to fruition. And you have to build an advisory that really care and understand. And it may include systems. You may have to pull people from the criminal justice system. You may have someone on there from the health department. It's going to take a lot of work to really get it up and lift it off the ground. And Phoenix is really helping us understand that deeply. So we appreciate them.
That's awesome. I love Phoenix. I've been watching them like from day one. They are an amazing organization, a great place to learn and we collaborate with.
Amazing. Wonderful supporters, and the work that they do is true and through. It's not storefront stuff. Like you open that door, you can feel that energy when you walk in there. You can feel the safety. You can feel it.
Mm-hmm.
You really can.
Absolutely. So one of the things that you said that you guys are doing with young people in recovery is something called pro-socials. What is a pro-social?
Yeah. So a pro-social is something that's safe, free, and fun, and substance free. So it's like a movie night. It's like going to having a bingo or something online. They're considered pro-socials. So the thing about it is that they're always free. Doesn't cost you anything to come to it, and it's safe. So you don't have to worry about substance use being involved. And one of our members actually runs his own organization, and it's called Joy Baltimore, and he does all of our pro-social events. So they do clothing drives, they do fun things, all kinds of cool things for young people. But a pro-social can be anything, and even down to bowling, even down to paintball. It's just a free, fun thing to do.
Oh, I love it. I'm totally coming to one of those. If you do paintball, I'm in.
Yeah. Yeah. So, we're grateful for collaborations, because without collaborations, we are absolutely nothing. So sometimes it's best to connect with people, connect with other orgs, and bring in people who care. So young people in recovery, again, because we're volunteer, we receive donations. So people donated things and we go out and purchase things, and we just purchased some hoodies from a donation. And it says, all its hoodies say, this is what recovery looks like. It's a real cool hoodie from people in recovery.
I love that.
We gave them out. So that was pretty cool.
That's awesome.
Yeah, it is.
So I got 2 questions for you to close out.
Yeah, I have one that says, yeah, go ahead.
Oh, no, wait, what does your hoodie say?
Yeah, what's your hoodie say?
My hoodie says, I love someone in recovery.
Yes.
Yeah, that's
awesome.
Spot on.
That's like so dope.
Yeah. That is definitely so dope.
I love it.
Yeah.
Yes, there's a lesson recovery. Yeah, and you can get them there online. They're available on youngpeopleinrecovery.com and .org. I'm sorry, youngpeopleinrecovery.org. You can become a member. You can create your own chapter. You can shop in their store, and they have some cool gear. So swag,
Yeah.
YPR swag. That's what I call it.
That's awesome. I love it. Okay, so got two questions for you.
Yeah.
First one is,
Go ahead.
you do a lot of work, a lot of really great, impactful, life-saving work. And my question is, what do you hope comes out of this work? Like at the end of the day, like if you were looking back on your life like 20 years from now, what do you hope comes out of this work?
What I hope to come out of this work is people understand their power within their own resources, and they live and thrive and be able to live safely in their communities. That's what I hope to get out of this work.
I love that.
Yeah. Thank you for that.
Mhm.
Yeah.
Thank you for that.
So, oh my God, yeah, that's super powerful.
Yeah. Not to derail the second question, you said something that I'm taking from this conversation for sure, which was we need people because people make up our communities.
Yeah. Can't walk
I
into
don't
a
know
community
whether,
without people.
yeah, I don't know whether I've just never quite heard it put that way before, but that struck a big nerve.
Yeah. They are
So
the
thank you for
foundation of
that.
our communities. Yeah. They are the source, you know. I wrote something today and said, stop waiting for systems to solve a people problem. So if we get to know our people and we educate our people and we utilize the resources that they already have, that's how we restore our communities. That's how we heal. That's how we thrive.
Yeah, amen to that. Communities don't exist without people,
They don't.
and systems don't even do anything without people.
They don't. Nope.
So true.
Very true.
So, how can people get in touch with you who want to
Yeah.
connect with your work or want to ask you about your work?
Sure. So to get in touch with the Maryland Peer Advisory Council or to me, you can visit the www.marylandpeeradvisorycouncil.org, or you can also email mpacalp@gmail.com.
Awesome. Thank you so much. Thank you for
It's
doing
been a
this.
pleasure.
This has been a
Yeah.
pleasure.
It's been a pleasure.
Yeah,
Thank
T,
you for all your work.
you are something special, and it's inspiring the work that you're doing, and it means so much. I think it's
Yeah.
you are such an awesome example of you took with you from your journey the things that left marks, and then you turned around and you tried to help other people walk through that.
Yeah.
And that's
You got
like,
it.
yeah, man, that's the stuff that makes the world go round.
Absolutely.
Some tolerance and some patience and some love just coming at strangers, and that I'm here for
telling you.
all that.
I'm glad to hear that. Thank
Here
you
for
so
all
much.
that. Thank you.
I always say together we can make a difference, and that is so true.
Indeed.
Absolutely. All right. Well, thank you all for listening in, and thank you, T, for being here. Of course, Eve,
Yes.
I'm just always glad to see your face.
I know. I love seeing your face.
Yeah.
Oh, and happy we're doing this on the 9th. So happy day after National Women's Day.
Hey, rock it out.
You know what I mean?
Awesome. Happy Women's Day.
Every day, happy National Women's Day, quite frankly.
Women
Every
are
day.
awesome.
Yeah.
Yeah. Don't get me
What
started.
fun. Thank you, T.
All right. Take care. Bye-bye.
See you guys.
Take care. See you guys.